Now on to health matters. The government has bemoaned the high impact of HIV on women as they continue to account for most of the new infections, with 9,200 out of 15,400 new incidents recorded in the country in 2023 being female. Our health reporter Dorcas Mufiri has more.
As Zimbabwe joined the rest of the world in commemorating World AIDS Day at John Cowie Primary in Rusape this weekend, the Minister of Health and Childcare, Dr. Douglas Mufiri, commended the drop in new infections in the country, but however noted that the HIV pandemic continues to carry a female face locally as women and girls bear a disproportionate burden of the disease.
Of the 15,400 new infections recorded last year, women accounted for 9,200 of them. Among adolescents, women also accounted for 1,500 out of the 1,700 new infections. Evidence has shown that this is largely driven by gender inequalities and socio-economic vulnerabilities that heighten exposure to HIV. Additional to the high-impact HIV prevention interventions already in place, my ministry, working together with the National AIDS Council, donors, and partners, is delivering key targeted interventions, including distribution and promotion of the female condom, the DREAMS and sister-to-sister programs, and various gender transformative programs, including the SASA model and interventions meant to ensure that young girls remain in school longer and that child pregnancies and marriages are eradicated in line with our laws.
U.S. Ambassador to Zimbabwe Pamela Tremont emphasized that despite the country recording great progress in the fight against HIV and AIDS in the past years, there is no room for complacency as more still needs to be done to close gaps and end the pandemic.
That while our progress is impressive, our journey is not over. We cannot go backwards. Let's work together to sustain the gains and accelerate the response to close the gaps and end the epidemic for all groups of people living with HIV.
The UN resident and humanitarian coordinator, Edward Callon, reflected on the importance of human rights in the fight against HIV and AIDS as this year's theme entails.
Achieving our goal to end AIDS by 2030 hinges on unwavering commitment to human rights and unfettered access to quality services. Ladies and gentlemen, the mantra, "only rights can fix this wrong," reminds us that acceptance, respect, and care for indispensable enablers for HIV programs to succeed.
The National AIDS Council Chief Executive Officer Dr. Bernard Madzima said there is need to harmonize and align HIV response in line with local and global standards and expectations to achieve and maintain epidemic control, as well as integrate NCDs in the treatment plan.
The National AIDS Council also coordinates and integrates AIDS-related issues like TB, non-communicable diseases, now with the drug and substance abuse, issues of disability and mental health, amongst others. And we continue to work with partners to make sure that the response is integrated.
The local theme for the 2024-25 campaign is Take the Rights Path, My Health, My Rights, Our Responsibility. This is a global call for leaders and citizens to address inequalities that hinder progress in ending AIDS. Dorcas Mufiri, NRTV News, Rusape.
Now Zimbabwe